Thank you, Larry. Next question, Ben.
How would lowering healthcare costs, you would do that with a one-payer system? Like a Medicare for all type of a deal, or?
A complicated question. I've written about it, but I'll summarize some things. First of all, it costs too much and it leaves too many people out of immediate care. So it's like Laura Ingalls Wilder wrote in her book about life on the prairie, Almanzo, her husband, you remember him, describing how the inequities of life show up on the prairie. And he said, you know, dear, everyone gets their ice out here on the prairie. It's just that the rich get theirs in the summer. And the poor get theirs in the winter. And that's the way it is with healthcare. If you have coverage, you get it timely. If you don't, if you're either too poor and you don't have dependent children in the home, you don't qualify for any health care coverage unless you have it through your employer. And 94% of the jobs created since 2008 don't come with health care. And if you make too much to get any credits on the exchanges, then you pay atrocious amounts. But if you go to jail, here's one thing. You get free health care in jail and prison. Paid for all too often by a lot of people who can't afford it for themselves. So the problems are, one, it costs too much. I believe that we address the immediate problem by offering this. We subsidize 75% of healthcare in this country. When I was an employee, or I was a government officer, I got subsidized healthcare because I didn't have to pay income tax on its value. And that happens to most people who have jobs who get health coverage. It was about a $5,000 or $6,000 a year subsidy for me. Well, I think that anyone who doesn't have health care coverage that's affordable ought to be able to buy into Medicare. That's what I believe. Until we come up with a better system, you ought to be able to buy into Medicare. And if you're looking, and if you don't have a job, like most people don't, we have 10 to 12 million Americans who aren't working or looking for work, and they're killing our economy in so many ways that causing the job shortages we have. They're filling our jails intermittently and our prisons. And their children aren't learning a work ethic. Mental illness, they're racked with addiction that's not treated. 1 in 10 addicts gets treated. They have felony convictions so that no one will hire them, and a host of other problems. We've got to address their needs and understand that health care is one of the things that will lift them up, lift a percentage of them up back into the workforce, to work our jobs, to be the parents their children need. And for those people, I believe they should be on Medicare and go into a work program to treat their needs, to learn a trade, and put them back to work in the economy over a period of, say, a year. And I think that that's what, when we start getting them into treatment earlier. Think of the money that we spend in healthcare. A hospitalist in Rapid City called me up and said, I need to tell you my story. I work the non-surgical patient load, and 40% of my patients are addicts. They come in to the emergency room. We treat them at tens, maybe hundreds of thousands of dollars of costs to stabilize them, but not to treat their needs, because we're a nonprofit and that's what our duty is just to stabilize. So we then, after spending all that time and money, release them back out into the community to do what got them here in the first place. We have to start dealing wisely with our healthcare dollars. And there are several other things that I recommend. One is price transparency. There's not one person here who would go into a cafe, open a menu, try to order a hamburger, and not know how much you're paying for it. And when you go to ask the waitress, how much is the hamburger? And she looks at me like you're from Mars or something. And goes and gets the manager. And he says, do you need to know what? How much it is? And then he gives you a toll-free number. You can call on Monday and they'll tell you how much it is. And then you find it's like $141. That's what happens in every transaction in every clinic and hospital all across America. A lot of data shows that just hanging prices on MRIs, even blood tests, so that you know that they're going to charge you $340 here, but down the street you can get it done for $35, is one thing that helps. I'm a big believer in community health centers. We have them in many communities, but not all, and they're on sliding scale basis that allow people who don't have other coverage to get in and get treated for a lot of basic needs, and even dental and mental health needs. That's a wonderful program, and it gets some federal help, but it's in a Horizon out of Howard is home to 21% of the headquarters for 21% of them. But I'm also convinced that we've got to stand up to Big Pharma. I have not talked to a single South Dakotan who thinks it's right that we spend 2, 7, sometimes 10 times the cost for our pharmaceutical drugs as Mexico, Canada, and Europe. And many of them needed to keep our neighbors alive. And yet our feckless Congress doesn't have the sense of justice to stand up for the American people. So that even when there was a bill in the Senate to try to allow the United States to import back American-developed drugs established under our patent laws and our system of government and our protections, to import them back so that we could buy them at rates comparable to the rest of the world. It failed in the United States Senate. And you know what? 10 Democrats voted against it, and every one of them got big money from the pharmaceutical companies. We ought to be holding them accountable. We ought to be enraged by that conduct. And what kind of a system, think about it, what kind of a system says that government cannot, that we're going to prohibit Medicare from negotiating for the cost of our pharmaceuticals? That's absurd. We are absorbing all kinds of costs so big corporations can make record profits. And it's time we get people who aren't bought and paid for there. I could go on, but that's just a taste of a few reforms that I think we need to look at.